This program is paid for by Innovative Medical Associates. All opinions or statements expressed on the program are solely those of Innovative Medical Associates or their guests and do not reflect the opinions of WPH.D or Odyssey.
Talk Radio 1210 WPH.D, WPH.D HD, WOGL HD3 Philadelphia. Now, Health Watch, featuring Dr. Molly FANTASIA, the PH.D. doctor and founder of Innovative Medical Associates, with valuable information that could help you improve your quality of life. Now, Health Watch.
Well, we'll start off with a public service announcement. It's 8:05.
That's right.
In case you forgot to change your clocks, you're probably, wait a minute, is it really? Yeah, it's 8:05. Good morning and welcome to another edition of Health Watch. We are here every Sunday, as you know, from 8 until 9, here on Talk Radio 1210 WPH.D. Health Watch features Dr. Molly FANTASIA, the PH.D. doctor, the executive director, and the founder of Innovative Medical Associates, located in Marlton, New Jersey. And as always here, we will discuss the who, what, when, where, why, and how of Innovative Medical Associates, how they can help you, and potentially help any member of your family with a medical challenge. 855-839-1210 is the number here in the studio, 855-839-1210. Challenge your clocks, right?
Oh,
you're here.
Sure I did. I changed my clocks already in the office as
right.
well.
Okay, so we're all good.
We're great to go, and I think everybody needed this extra quote-unquote hour of sleep, and, sleep's important, John.
That's right. I was thinking, we're coming on the time of year where it's holidays, Thanksgiving, Christmas, and all of that stuff, and people tend to put off their health.
Yep.
We'll deal with that after the holidays. And that's everything.
That's not just us.
Right. And I thought if I would have put off the stroke situation,
oh, my goodness,
where would I have been?
No.
So I think you want to talk about that type of thing.
It's interesting, John, because I have a lot of patients, we are a medical hydration facility. You know that. So I see patients who have problems or have had a problem in the recent past, and want to get on top of it so that they don't have an additional problem. And I would say that's true for you because of people know out there you have several comorbidities.
Right.
And gosh knows, in 20 years, John, we've been treating a lot of them. And you are not alone in that. Most of my patients, who ultimately the goal is to live a very long life. I believe the Bible says we can live to 120. You've heard me say that.
Yes.
But we want to live well. And here's the thing. I am very focused that people need to stay on top of their health, regardless of whether it's the holidays or somewhat big vacation, whatever. Yes, I don't want people to go steady with me, John, as you know.
Yes.
But what I do know is I want people to stay on top of their particular health, because you saw it and I saw it.
Yes.
It can go bad real quick.
That's right.
Real quick.
And that's why I wanted to point that out. So let's talk now about Innovative Medical and what they do and how it's different, and just talk in general.
Well, listen, we are a group of like-minded healthcare providers who work out of my primary care facility in Marlton, New Jersey. And our philosophy is that of primary care, meaning we want prevention. We want to make sure that people stay on top of what is traditional as well. So we can do everything that a primary care facility can do. If you need an antibiotic, you need, you've heard this data now for the whole year. If you need any type of pharmaceutical, of course, my doctors can write for it. But it's really the philosophical difference that changes us from everyone else. We believe in using the least amount of pharmaceutical to effectuate the change by augmenting with the natural substances, things you might find and utilizing those to possibly help you get off of your pharmaceutical if medically appropriate, and or effectuate the change by augmenting that by using a smaller amount, so we reduce the side effects of the pharmaceutical and not just the condition.
And many times you've helped people get off that medication.
Sure. I would say that in our cardiovascular protocols, we have done an excellent job in helping people actually reduce their need for some of the pharmaceuticals as related to lipids. And I would tell you that we've also been able to help people reduce their blood pressure meds. That doesn't mean we tell you throw it out. We're not going to do that. I mean, we are a bona fide medical facility, and what we want to do is help a patient maintain their quality of life no matter what the condition is.
Talk about when people get the initial consultation.
Sure.
What is discussed there, and really what can they expect from
Well,
that?
you know, it's a funny thing. I'm getting more and more people who are calling me on the phone and want to do the consultation over the phone. And honestly, I'm not comfortable with that all the time because I want to see really what you're taking. I want to see if you have any radiology reports or you have any laboratory results or whatever. There's one thing I know. There's something about seeing a patient in person for that 20 minutes or 30 minutes to really get a feel on what they've gone through for their condition and where they are right now, and how can we help you achieve your goals, which I assume you're calling me because you want to improve your quality of life.
Right. Well, I can attest to that because the day of the stroke incident, you looked at me and said, "You don't look good." And had that been over the phone,
right.
you
no,
couldn't.
No,
you couldn't
because
tell.
you really sounded okay.
Yeah.
It wasn't until about 20 minutes later
Yeah.
that we started to see some of those effects, which
So-
is interesting.
So the initial consultation should be
In
person.
if possible. Now, I have people who fly in from out of town. I just did one yesterday, a woman in Florida who's going to be coming in to see me after the holidays. And I said, well, do what you will, but the bottom line, there's a serious cancer situation there. They've already had some traditional therapies that right now the doctor's saying there's not much more to offer this person. And it's a certain form of very, very aggressive cancer. And I wouldn't wait. I'd be in, and as you know, I have
Yes.
people flying in from California, Florida. Are ways to help improve your quality of life. We can't cure the cancer. We're not going to cure the cancer. But obviously the traditional guy isn't curing the cancer either.
Yeah. What I wanted to ask you was, with regards to the treatment
Protocols.
Sure. How many treatments could you expect?
Look, here it is. If you come in and you're, you can't walk, 20 feet, obviously you're going to need more than 5 treatments,
Yes.
right?
Yes.
For whatever's going on
Yes.
for you. So the question is, people tend to see improvement in around 10 treatments at least, which is usually between 5 and 10 weeks, depending on the protocol that I put together for them. But it's fairly quickly. We can see results for a patient in 5 to 10 weeks, and I think that's maybe a little quicker than some of the medications. And we start to help people wean off probably somewhere around 10 weeks as well. And we don't want people to have a rebound, so we're very careful in how we do this, my docs and the staff. So that's the long and short of it, John.
And does it work? That's the question everybody.
You data till wait till you see the new test. Remember the test we were
Yes.
talking about a few weeks? Well, I finally are getting them in. Wait till you see that. I'll show you data that'll knock your eyeballs out. People who started with me years ago and where they are with their inflammation markers, and people who are just starting with me when we're going to compare these tests. I can show you that till we're blue in the face. But the real question is, how are my patients feeling?
Yes.
And you know it, and I know it. We can't take the minds of everybody who sit through that
That's
clinic.
right. Well, we're coming up on our first break of the morning. It is Health Watch every Sunday, 8 till 9 here on Talk Radio 1210 WPHT. Dr. Molly Fantasia is here, and she's ready to talk to you at 855-839-1210. That's 855-839-1210. Health Watch is the program. I'm your host, John DeMasi, with Dr. Molly Fantasia. We will come back with more of today's Health Watch after these words. We are back here on Health Watch, and as always, operators are standing by right now at Innovative Medical Associates, and the number is 856-489-0505. I'll do it again, and I'll say it slower. 856-489-0505. That's the number, Innovative Medical Associates. And again, you can call them and schedule the appointment with Dr. Molly. It is complimentary. The website, innovativemedicalassociates.com, innovativemedicalassociates.com. That's the website. Check that out as well. It's Health Watch, Sundays 8 till 9 here on Talk Radio 1210 WPHT. If you want to talk to Dr. Molly right now, 855-839-1210 is the number, 855-839-1210. We want to talk about, I guess it's appropriate this time of year. We talk about team players.
Right, exactly.
The
Correct.
Nutraceuticals working together.
Correct. Synergies, right? Just like our Phillies did up until this past weekend. But no, the synergies, nutrients, whether they're vitamins, minerals, amino acids, etc. So I wanted to put together some of the team players that we use. And one of the things that came up, obviously, is vitamin D. So we form our vitamin D. We have a very specific vitamin D in a specific oil because the oil itself has some antioxidant properties. And John, what do you know about vitamin D?
I know that your nurse Barbara tells me that I have to take it.
Good.
So that's number one.
Good.
And number two, I know it's for immune system.
Right. And
strength.
And when we really did it play a major role in immune system, it played a major role during COVID-19 because you'll remember that we talked about the synergies of vitamin D, vitamin C, and zinc. So there was a situation where a protocol actually called for different types of nutraceuticals within the protocol. And of course, we did that. But vitamin D is an important in many other areas too. For example, it's very important in cardiac and pulmonary functions because of the inflammation modulation that it does. So vitamin D is an anti-inflammatory as well. I've been seeing vitamin D with our athletes, using it in our athletic protocol because, again, we know that it definitely helps with bone strength. Women have been told for years, you got to increase your vitamin D. And since we've been seeing so much more vitamin D deficiencies in our population, meaning function, but it has an actual function in addition to that. For example, in using this for folks who are highly athletic, and I'm seeing people who are doing marathons right now, I guess it's the time of year, right?
Yes.
They found that the scientific literature showed that there is a perpetuation of using vitamin D, and it may help decrease athletic injuries. So that's an interesting thing. So it works on the muscle proteins as well. Interestingly enough, there is data to show that vitamin D deficiency also is associated with impaired lung function. So think about that with the virus, and you could see that, immune, but it actually has a mechanism to improve the pulmonary function of a patient. So there's another reason why we use it in our facility in various protocols. So again, cardiovascular function, lung function, and bone function. So that being said, that's one of the particular team player nutrients I use, along with something called glutathione. And glutathione's used extensively in our protocols for liver. So we may use vitamin D and glutathione in some of our liver protocols, particularly, again, the vitamin D used with a particular antioxidant type of oil. So vitamin D with glutathione we've used for people using for lung function, also for liver detox. It's very important in detox, believe it or not, D and glutathione. So when I talk about synergies, it's how we use these things together, not only the dosing, but when I might use them within a particular protocol. So again, we aren't a spa because you don't think about things like this. You have a set protocol and you throw the vitamins in, you throw the stuff in, and you say, okay, this is my headache protocol. Yeah. This is my cardiac protocol. And there's a lot of data to support protocols like that. Believe me, there's tons of it.
people have always said, I get plenty of sun with, so I get
No.
That's a myth, right?
That's a myth, and it's been a myth for years and years. Although vitamin D in its true form, D3, which is what we like to use, is synthesized in the skin. In the skin functions, but really it's just not enough. That's why there's such a deficiency. And I'm going to tell you something else. With all the toxins that are out here, by that I mean things in the environment, etc., there's been an effect on vitamin D and glutathione levels. That's why I like to use them together for the environmental medicine part.
Your vitamin D is your protocol vitamin D.
Absolutely.
So
It's D3 in a particular compounded oil that we use, and we use only D3.
So you wouldn't get that anywhere else.
Well, no, you might get it in a synthetic oil.
Yeah.
People go into their docs and they get a $25 D shot. Okay, that's cool. I have no problem with that. If you can only go to your corner doctor and get that, it's okay. And if you can go to the corner spa, get it. Specific protocols in a specific manner with a compounded oil.
You use this also in your PRP?
Oh, yes. Not on the day of the PRP, but on the follow-up. As you know, I like to use things. I don't just insert, I don't insert at all. My docs do the needles. But the protocol that I developed is saying, okay, let's give the platelet-rich plasma, let it rest, let it gel. The next day or so, what we like to do is have the patient come back, because we include an IV therapy in this, and it's the utilization of vitamin D in a particular form to help sort of set this thing and help improve the quickness by which patients tend to do better after the shot.
Would you recommend you get vitamin D in the health food store?
Well, you can.
And is
sure.
that
D3 with K.
not the same thing, right?
No, but D3 with K is better than nothing. I see these D levels that are way down. I had a patient who came in with a D level of 12, and our levels start at 30. Okay, and even that's not enough. Like for someone like you, we like to see it way up almost to 100, John, and you'll know that. We've said it before. Barbara's going to get on you, okay? But it's fact.
Well, she did tell me one time. So you got to take it. So I've been taking it
now I know,
ever since.
and a specific type,
yes,
which is what I'm saying.
Right.
So you don't want to just get junk.
Right. But you would take it as a supplement.
Yes.
But your protocols would certainly
this
be
gives it a
far
heck of a
superior.
boost.
Yeah.
Absolutely.
Yeah.
Absolutely.
What else is it good for?
Where do you want me to start? I mean, I would say the anti-inflammatory properties of vitamin D not only are good for the cardiac, and that's really important. One of the things we talked about was certain called instant cardiac death. Have you heard that with the young players out on the field, that kind of thing? It's an interesting thing, but I read a scientific article that said each one of those players had low vitamin D level. So it's something we should look at in terms of many functions and know that sudden cardiac death associated with exercise, there is a problem with the physiological adaptation of the vitamin D that they're getting. So it's something that people should be aware of.
Should a runner take vitamin D?
I would say all the runners in our facility are definitely taking vitamin D, along with a couple of the other things we're going to talk about.
And how would it increase their
durability? Right.
I guess?
It's going to increase their ability to have recovery, and that's really the important thing. When our guys are out there, yes, they'll give it all they have, and we're going to give them some other nutrients that, by the way, are not banned, natural substances that really can help improve their performance, but we also want to worry about their recovery after their performance, because most of these people have to go back to training.
Yes.
And that's important.
So the recovery is helped by this.
Oh, yes. And the recovery in many areas is helped, including the immune recovery.
Okay, that means we're coming up on the halfway point of the show. Wow, time flies when you're having fun, right?
Yes.
Sundays 8 till 9, Talk Radio 1210, WPHT. I'm John DeMasi with Dr. Molly Fantasia, the Ph.D. doctor, the executive director, and the founder of Innovative Medical Associates. You want to talk to Dr. Molly right now? 855 855-839-1210 is the number. Whether you have a medical challenge or you just want to answer a simple question, 855-839-1210 is the number. It's Health Watch, Sundays 8 till 9, Talk Radio 1210, WPHT. We will come back with more, Dr. Molly and I, right after these words. And we are back here on Health Watch. Don't forget, operators are standing by right now at Innovative Medical Associates, 856-489-0505. Again, 856-489-0505. And the website, innovativemedicalassociates.com, innovativemedicalassociates.com. Check that out. A lot of good information on the website, innovativemedicalassociates.com. It's Health Watch, Sundays 8 till 9 here on Talk Radio 1210 WPHT. 855-839-1210 is our number here in the studio, 855-839-1210. We're going to go to the phones and talk to our friend Frank in the Northeast. Frank,
Hey,
good
Frank.
morning. You're on Health Watch with Dr. Molly.
Hey, Frank, how are you?
Good morning, Dr. Molly, John, and everyone in Dr. Molly Land, okay? You got your own thing now, Dr. Molly Land. Just calling to update you. I talked to you 2 weeks ago. I talked to you 2 weeks ago about the osteomyelitis. The operation on Tuesday, the 25th, went well. The bone, they told me, is actually crumbling apart before they tried to remove it. It was just crumbling. It was crumbling on its own. I'm right now in the facility where. Also, it showed methicillin-sensitive Staphylococcus aureus. It's MSSA, not MRSA. MSSA.
Yeah.
I'm not familiar with that one.
I understand.
What
listen, it's bad. It's a certain type of bacteria.
Well, currently I'm
antibiotics, which is why I'm sure. Yeah.
Yes, I'm on.
What are you on, John? What are you on?
Frank.
Ansep 6 grams a day. I get 2 grams every 8 hours with the pig line.
Good.
I'm in the facility right now. PTO2.
It sounds like you're doing. Yeah, it sounds like you're doing okay, so thank God. I'm going to tell you something. I'm very happy you went in and had this done because you and I both know that you can't fool around with osteomyelitis. You know, that could have affected many more things besides, your bones. In fact, it's something to worry about. Frank? May
But
God
Dr. Molly,
bless
did you ever
on
hear
this.
did you ever hear the bone crumbling before they tried to remove it on its own?
I believe yes, because what happens is obviously the bacteria is in the middle there, and it's probably in the marrow. You know what I mean? And it's weakening the sides of the bone. I mean, that's probably the truth. I'll tell you what, Frank. I hope you're on D3 with K2. I hope you're on that for your bone health. I mean, at some point.
I was on its own, but
why not?
I didn't. Well, I got to bring it here. I'm in the facility right now. I have it at home.
I didn't know that. Yeah. Listen, when you get home, start it again. Let me tell you something about the facilities. Barbara and I laugh about that all the time. It's like when you get there, you're in their land now, right? And let me tell you, they don't go for anything from the out. They won't let you do, and you're very smart. You know these supplements you ought to be on. It's like, oh my God, we got to get them into you. You would think we're bringing in contraband. So.
Well, I'm in the process of doing that right now, but I can't say.
Get home.
Can't talk about it.
Okay. God bless you, my friend.
Frank, good luck with everything.
God bless you, Frank.
Thanks for the call.
That was a nice call, but I didn't realize he was in the facility, John.
Yeah. He sounded a little weak, too.
Yeah, sure. He's going through it right now. Anyway.
855-839-1210, that's our number here in the studio. You have a patient.
Right.
And you wanted to talk about this NAC.
Well, NAC and NAD, and not to be confused with each other.
You'll tell us the difference.
Right now. Well, NAC is very important within antioxidant production, and it's made from 2 other amino acids, glutamine and glycine. So the reason why I mentioned it is because we talked about glutathione. And NAC is very important in glutathione production. So if you think about glutathione being an important antioxidant that neutralizes free radicals and damaged cells, you would see why I might want to use NAC to make sure the glutathione production comes back, because NAC alone actually can boost brain health by regulating the glutamine and replenishing your glutathione. So indirectly, I'm treating this with the NAC to upregulate this particular patient's own glutathione. So I've used this extensively, this protocol, for people that have had things like dementia, early dementia, Alzheimer's, memory loss, that kind of thing. And what it can do, it can slow down the progression of that disease if caught early enough. Another thing I'm using it for, John, is Parkinson's. So, it can help with regulation of the respiratory problems as well. And as you know, I use that with glutathione for lung conditions, that type of thing. So there are many reasons to do this, to use the NAC. But again, it's how you use it in conjunction with the other team player, the glutathione. That's why I'm mentioning all these. And in many cases, I use vitamin D also in these types of condition. So again, the glutathione will boost up the immune system, and that then helps with certain other things. By the way, I have to go back to a story that, 26 years I'm here. It's been very, I have lots of stories. But I had a case that actually had to do with fertility. And I'll never forget this, because the gentleman came in and he was told by the fertility company that he had he's the one who had the problem. Well, guess what? We treated him with NAC, glutathione, and believe it or not, he sent us a note. And he was with us for about 10 weeks, I will tell the truth. His wife was very distraught. They were very young. They were not real young, because we think about 30s as not being young to have children.
Yes.
But I think of it as young.
Yes.
Even then, I thought of it as young. And believe it or not, they had a beautiful baby girl. And I just got a note from them about maybe 2 or 3 weeks ago saying that the baby girl is now 15.
Wow.
And it's their only child. But I do remember that case like it was yesterday. It's one of those cases that you just remember. And again, it didn't take the place of the fertility treatments, but what it did was it boosted the mobility of his sperm and increased the sperm production. So there's lots of reasons to use NAC. And again, I'm treating a patient with depression, and so we know that that helps. Now, I'm also using NAD. That is different than NAC, and it's one of the things I want to talk about, because I'm seeing more and more of these spa-like places talking about the anti-aging abilities of NAD. I want people to really think carefully about where they go for NAD. We cut our teeth on NAD in addictions, because we found that NAD is a coenzyme that plays a vital role in the body's biochemical process. Things we did was we looked at people who were on the West Coast using NAD, and they were physicians, very smart physicians, associated with a couple of the large organizations there. And I have a very good friend who is a clinical nurse specialist who put me in touch with these folks. And what we did was we put together a protocol of NAD, utilizing those for addictions. But what we found in doing that, we also were able to help people with depression and anxiety using the NAD.
So NAD,
different than NAC.
NAC.
Right.
So what can you tell us simply that tells us the difference between NAD and NAC?
Well, here's the thing. Nothing is simple, and everything, as I say, everything works on a cellular level. The question is how you utilize these two substances together, and when do you plug them into a protocol. So our protocol for depression and anxiety is we use the NAD to improve the depression and anxiety by stimulating the production of the neurotransmitters, the coenzymes, and things necessary for brain and nervous system, okay, so that it relieves the symptoms. Then we might plug in the NAC for some of the comorbidities that is used. So this patient that I'm doing, I think we're on the 3rd week with her. So we know that this is going to be a little bit of a challenge. It isn't holy water. We don't sprinkle on you and you become completely happy. It doesn't work like that. We really have to get the sense of relaxation. We have to build up a therapeutic level of the NAD, and it has to be done carefully. That's why I want people to realize that NAD, you must really, although there's no long-term side effects, people can have certain short-term side effects that are like flu-like, and possibly you feel like they're cardiac, but they're really not. And you really want to be in a place that's really, I guess, prepared for any emergency, like my good nurses and my whole clinical staff.
Okay, we are coming up on our final break of the morning, which means you still have time to jump in here and ask a question of Dr. Molly, or if you have a medical challenge you want to run by her, feel free. 855-839-1210 is our number in the studio, 855-839-1210. It's Health Watch, Sundays 8 till 9, right here on Talk Radio 1210 WPHT. With Dr. Molly Fantasia, the PhD doctor, the executive director, and the founder of Innovative Medical Associates. I'm John DeMasi. We both return. Final thoughts on Health Watch after these words. Hi, it's John DeMasi, host of Health Watch, Sunday mornings at 8 and again at 4 here on Talk Radio 1210. Have you or someone you know been diagnosed with cancer or breast cancer? Dr. Molly Fantasia and the healthcare team at Innovative Medical Associates can help. They offer medical hydration therapy. Their cancer support program is designed to reduce chronic symptoms often associated with diagnosis or treatment, including pain and fatigue. Dr. Molly's unique protocols have improved quality of life for hundreds of patients.
I want to help you heal. I want to help you have a quality of life while going through cancer treatments.
Visit innovativemedicalassociates.com to learn more about their cancer support treatments. Join me and Dr. Molly when we discuss the benefits of medical hydration and more on Health Watch every Sunday morning 8 till 9 and Sunday afternoon 4 till 5 here on Talk Radio 1210. And we're back here on Health Watch. Don't forget, operators are standing by right now, and they will be there well after we leave you at 9 o'clock. They don't take the day off. Are you kidding? 856-489-0505 is the number. 856-489-0505. And don't forget the website, innovativemedicalassociates.com. Innovativemedicalassociates.com is the website. And also, we want to remind you that we have our Health Watch replay right here on Talk Radio 1210 WPHT this afternoon, 4 until 5. If you miss any of today's show or you want to hear it again, feel free, 4 until 5 this afternoon, Health Watch replay here on Talk Radio 1210 WPHT. It is Health Watch, the live version right here, 855-839-1210 is our number here in the studio. Still have to 1210. This patient you want to talk about, Dr. Molly, with the vascular problem.
Sure.
Sure. What is the situation?
First, here's an interesting case. A very wonderful patient of ours brought her friend in who had a wound on the bottom of her foot, and she had reduced the patient who had the wound obviously had reduced vascularization down to her feet. Well, she's great. The wound is healing over. Everything is good. The patient who brought her went back to her doctor to have a scan on her carotid arteries, and she was very upset on Thursday. And when I asked why, she said, the Doppler study, said she was worse. So I was a little confused, and it could be. I mean, as I tell you, we don't tell you not to do conventional. So I said, well, why don't you wait and hear what the CT says as well as the Doppler and let them put it together before you say. Turns out that there is no significant change on the CT showing the blockage. She started at a 70. The radiologist read it as 72, but in the report he said ostensibly that means nothing. It's probably stayed the same. So, I mean, I think she's faced with having the surgery, but I also told her that's fine. Do whatever your doctor tells you. But what do you think my job is going to be after that?
Recovery
And keeping her vascular system open when they put these stents in. She obviously makes the believe that it's because we just didn't have enough time in this case. When you're up around 70%, it takes a little longer to really extract this, and you really don't want to put your patient at risk. So if she needs to go back to the neurology people, go do what you have to do, but she should be in my chair after that at least once a week for 10 weeks.
And then maybe sometime beyond that.
Of course.
Beyond that,
because if you don't think that the vascular issue is the reduction in the blood flow, what would I want to use? Chelation, Plaquex, things like this to maintain the integrity of those stents. So stenting only helps you. Remember, stenting only helps you unblock one portion of this.
Yeah.
What about the rest?
And you got to keep the stent open, too.
Right. What about the rest, guys?
Yeah.
That's the point. The point is there's some long hauling involved in these vascular conditions.
So you would recommend that she continue.
She has to continue with her
continue
neurology
that.
people. I get that. But I think that she's going to be a lifer. As hard as that is to say, some people make a lot of inflammation and a lot of plaquing. And that test that I sent out for you that I'm getting back this week,
yes,
finally, is going to show me where her lipid dysregulation is, which means I can get more specific after the stents are in to help her maintain the integrity of those stents.
And the test is?
The Cleveland Clinic cardiac, vascularization.
I'm waiting too.
Oh yeah, they're in. I'm just going over them, John. They're very extensive. They're 7 pages long.
Wow.
So I really need to look at these carefully. But I'm done today. It's the Lord's Day, and I'm done. So
you take homework home every week, right?
I do. But Sunday afternoon, I want to stop.
Yeah. Okay. Well, you're allowed one day to relax.
I think so, John.
Yeah.
We're up there in age.
Talk about other patients with similar conditions where this chelation can help in this case.
Look, chelation has been around for many, many years. It's very good in the lipid exchange. It helps the plaquing. It can improve blood flow 12% head to toe. That's a big number. In addition, there's a lot of German literature to look at phosphatidylcholine developed in a certain way to utilize also the soft plaquing and the vascularization of the inflammation between the vascular wall and the artery. So there are many things. What I want to do is really see what's causing our particular patient or any patient. What is the problem in the lipid challenge? What is the problem? What's causing them to continue to make the plaquing? Now, obviously, if you're out there eating a ton of sugar and you're out there eating a ton of red meat, heck, you're causing your own vascular problem, okay? That's the issue, John,
So in this case where you're talking about chelation and you're talking about all these plaquings, the stent is only as good as...
It's only as good as we can keep it open. And remember, the stent only opens up one part of the vessel. What's going on in the rest of the vessel? This is why people end up going in. And at what point do we send stenting is enough already? I mean, like, I would want to be on the diet. I would want to follow everything, and I try my best to do that.
It's
a bite because, again, I need help from the patient in order to do this, John. It isn't a question of the holy water going in and doing what has to be done. The rest of this has to be done by diet, etc., and following whatever we ask you to take on the outside as well. Good quality product.
Guess what? We are out of time.
Okay.
That's going to put the wraps on another edition of Health Watch. Don't forget, Dr. Molly and her operator is standing by right now at 856-489-0505, 856-489-0505. And the website, innovativemedicalassociates.com. Check that out for yourself, innovativemedicalassociates.com. That's the website. And, of course, we'll be here at 4 this afternoon with our Health Watch replay, 4 until 5. For Dr. Molly Fantasia and everyone at Innovative Medical Associates, the lovely Linda, our nurses Barbara, Catherine, and Lana, delightful Dee, Joanne, fabulous Fran, and our medical assistant Karen Kathy, I'm John DeMasi. Thanks for listening. Stay healthy, and we'll talk to you next week. Health Watch here on Talk Radio 1210 WPHT. Take care.
This program is paid for by Innovative Medical Associates. All opinions or statements expressed on the program are solely those of Innovative Medical Associates or their guests and do not reflect the opinions of WPHT or Odyssey.